So today video we have Mr. Mina Youssef, a consultant breast surgeon. He will tell us about his journey and if there's any tips and tricks or any advices he can tell us to get our CESR application accepted easier, and if it's doable or if it's easy to do it. Thanks. You can.
Thank you, Amira. Thank you for having this series of videos. They are really very important. Thank you for organizing that. So as you said, my name is Mina Youssef. I'm one of the consultant surgeons in Norfolk and Norwich University Hospital in Norwich. I have done the CESR application. My application was accepted in January 2018. I was a staff grade or specialty doctor for a while in the UK, moved along different areas as you would do in the country. So sometimes I spent some time in London, some time in the southwest, in Exeter mainly. That's where I spent most of my training. So I know that there are other videos that cover the process, but basically for me, if I want to speak about it, like from my personal experience, the CESR is a journey, and this journey is where you're trying to demonstrate two things: your skills and your knowledge. And this to satisfy the criteria to make sure that you can practice at the level of a UK trained consultant. So that's what it's all about. The knowledge you demonstrate by passing the exam. So that's a straightforward, everybody, including the trainees, they have to pass the exam. So the knowledge part is covered as soon as you pass the exit exam, the FRCS. The skills is what you need to demonstrate because they didn't have the chance to train you. They didn't know, they didn't see you acquiring these skills. So you want to demonstrate to make sure that they are happy, satisfied, that you have the skills required for a day one consultant. So if you look at it like that, you will enjoy the journey. So I know it is stressful, but also it is very beneficial because along our trainings, there are areas that we need to have it covered to be able to practice safely and enjoyably as a consultant. So if you think about it like that, you will really enjoy the benefit of that journey. Having said that, the process is designed in a way to be putting people off. So my first advice to you when you apply is don't be disheartened. Don't lose hope. It is supposed to be to create these feelings in you. Just keep trying. Just keep trying. It is quite normal for the application to be rejected first time. It's not unheard of. It's not abnormal. That's not. I mean, it's quite normal in the process. It is built in to put people off, unfortunately. But the good thing about having the application rejected is that they actually identify the areas that they want you to cover. So they cannot reject the application full stop. They have to reject the application with areas that you need to address. And this is good news because it kind of directs you where you need to do, where you need to go. The areas that are gapped in your CV or in your training that you need to cover. So if you keep on thinking of it in a positive way, that it is addressing the gaps in your training, it is proving your skills that you already have, you will enjoy the journey and you will get it at the end. I speak for a few minutes about my own journey. So I started to do as a specialty, my job was a specialty doctor initially in general surgery. I personally did not have the plans to stay in the UK. That's why I did not bother to apply for a training number at one point when I first came in. However, things changed, and at one point I found myself actually I have to give credit to my supervisors and my trainers because they encourage me to do that. And that's one tip I want to give to my colleagues who apply, is make sure that when you do the application, you do it from a place where you are very well supported from the people around you, from the consultants around you, because it makes a whole difference. It makes a difference for you in the journey because they validate the evidence and they support you, but also it makes a difference in the reference. I later on found the references, I knew the references after my application was accepted. I had a look at the reference, and it's quite exhaustive. It's a very detailed reference they give, and they have to be very supportive. Basically, they have to believe that you can be a consultant colleague. So choose your referees well. Choose where you are going to submit the application from, because this is what makes the difference. If the place is supporting you, you'll probably get it. So that's another tip. At some point in my journey, I was supported very well by one of my senior colleagues who said, well, you passed the exam, why don't you become a consultant? I said, well, I'm not sure, I have this long-term plan. I said, well, just do it. And that made the whole difference, because they were very supportive. The third tip I would give to my colleagues is gather all the evidence you can. Everything you do, even an email message, an email that reaches you from a colleague who is very happy on how you treated them. That's an evidence in itself, because they're trying to paint a picture of who you are. Are you a safe person? Are you a well-trained person? Do you have the necessary skills? So anything that contributes to painting that picture, it's good to put it as evidence. So gather the evidence as you go. Interesting cases that you have been involved in the management, anything that outstanding that you did, any teaching session that you did, any rota organization that you did for colleagues. All of these things count, and they can be submitted as evidence in the relevant fields. I'm sure this has been covered in other talks, so I'm not going through this, but in the relevant fields, the evidence needs to be sent in a clear way. So gather the evidence as you go and seek evidence. In other words, when you do something, when you do a procedure, for example, and you do it independently, or you are on call, and the patient is safe and everything went all right, it is very sensible to approach the consultant and get a PBA or get web-based assessment about that, even a CBD. All of these things are required from the trainees, and so are required from you. So it's a good idea to gather this as much as you can as you go along, and from as many people as you can, because they also look at different input. It's not good that you have the evidence from one consultant only who is just saying that you're good at doing this, good at doing that, good at doing that. That's great. But if you have the same evidence from 3 or 4 different consultants, it counts better, counts more. This leads me to the 4th tip. It's the weight of the evidence. Not all the evidence is equal. A lot of things have more weight. More recent evidence has a much heavier weight. So a lot of my colleagues, and including myself, we try to include evidence from when we were in Egypt, for example, when we were training, which is good because we have extensive experience, probably more than a trainee in an equivalent stage. However, the longer you are far away from that evidence, the less weight it has in a CESR application. At some point, I think they mentioned the cutoff point of 8 years. I think they keep on reviewing that every now and then. But the message is, the more recent the evidence, the more it counts. So try to get your numbers more done in the UK, because this carries heavier weight. If you have to get some of the numbers from Egypt and get it validated properly, it will count, but it will not have as much weight as a more recent evidence. So this was the 4th tip, the weight of the evidence. There are things that you need to emphasize when you are presenting your evidence or submitting your application. And this leads me to the 5th tip, is the way of presenting things. A lot of my colleagues who come from Egypt are very, very experienced. They know very well, they have very good skills, but it's a matter of how to present that. Always remember, these people who are reading your application, they know nothing about you. So you have to tell them they have never been to Egypt, maybe. They don't know how the Egyptian training system, they don't know your experience. So you need to tell them. For instance, I used to write a cover letter to each part of the application. So I say, here in this application, I'm presenting my logbook. part of the logbook is done in the UK in this so-and-so hospital and is validated by Mr. So-and-so. And the other part is done in Egypt. While in the context, I was training in this institute and they have this case mix. It's a very nice thing to explain your evidence, to write a cover letter. I even wrote a cover letter for the whole application. I said, so I need to cover these points, my skills, and so, number one, and I present evidence for this, and this, and this. This way you are taking the person through your application in a nice way. You're presenting yourself, you're presenting the things you know. So that fifth step is the presentation. When you have a nice letter or thank you card from a patient or thank you card from a colleague, put it down as evidence, but it's a good idea if you have all of this section with a nice cover letter saying, I present here some thank you cards from my patients, which shows that I treated them with respect and dignity and I was always empathic to them and I was like, I made them feel comfortable. Nice thing. Yes, you might think it goes without saying, but believe me, they know nothing about you. So you need to explain, you need to put this, like present the way. The nice presentation makes a difference. These are my 5 tips. And also I just touch a little bit on my journey, just to sum it up. I had my application accepted in January 2018. It was rejected first time, and they addressed some gaps in my application, which as soon as you address them, and again you mention that you address them, it's granted because they have to be faithful to what they recommend. So that's a good thing. When the application is rejected, don't be disheartened. Take it as A, for yourself is a way to address the gaps, and B, it clarifies what is missing. So basically the application is almost granted once you address these gaps. So just don't be disheartened, and we're very happy to take any questions. And if you want to contact me later after these videos. Thank you.
Thanks a lot. That was helpful. I have a question. I think the process now keep changing in the last few years. Do you think that there are is it the process easier or more difficult? And if they are now trying to support more of the CESR applications for people to get more consultant because now maybe the training is getting a bit harder?
Certainly, I think it's getting easier. In one aspect I can be sure of is that they got rid of the paper application. When I submitted my application, I submitted about 6 kilograms worth of paper. So I'm sure it's much easier to validate that electronically. I had to actually physically print everything. I had a dedicated part in the house with the printer and the paper, and I print them one by one, and then I go to validate them with a stamp and the signature. So it was really exhausting. So at least the new application doesn't need all of that. You validate it electronically. I know from colleagues that you send it to the consultant once validated, and they validate it electronically. That's much easier. To answer the second part of your question is the CESR application approval rate has phases. So sometimes it's open because there is difficulties in the training pathway and they want more consultant, and sometimes it is closed and they become more obstructive. But I wouldn't worry about that much, because if you have a good solid application with the right evidence, you're going to get it. So don't worry too much about what's in the policymaker's mind, or whether they open it or close it, because eventually the right time you will get it. But what you need to worry about is getting your application right, and more importantly, address the gaps or address the areas that they tell you to address. That's what I would recommend.
When people recommend that or advise that you go to the hospitals that support people to do CESR, is it there are that these hospitals are they support CESR application, or is it different experience from person to person in the same hospital? And then if I go to a hospital that support it, do I go and tell them, okay, I'm doing CESR, I want your help in 1, 2, 3?
I think, Amira, it's a very good idea to tell everyone that you're doing it. Trainees have a named education supervisor, while the SAS doctors don't. It's a very good idea to choose an education supervisor as soon as you start a job, and to always meet regularly with them. As a CESR applicant, you take charge of your own training, which is the difficult part of the CESR application. The trainee is well supported because they have these regular meetings, and they have their ARCPs, and they have their education supervisor assigned to them and everything. You need to do that for yourself. So when you join a new place, and depends which stage you are. I mean, obviously, if you're joining them and you have in mind to sit the exam, obviously you have to tell them that you're sitting the exam because you need their support to sit the exam. If you are past that stage and you already passed the exam, it is good to mention it, probably to the clinical director or for the lead of the department. And it always gives a very good impression when you say, I want to have an assigned education supervisor, and approach them with that. That's my advice. Have an education supervisor, meet with them regularly, maybe every 6 weeks, every 8 weeks. Make them aware of the progress of your application. So this way you have all the department on board. People are generally very supportive when you involve them in what you're doing. And generally people will be likely to support you. So don't, while if you try to do it away from the support of others, and then all of a sudden come and say, oh, I'm submitting the application next week, I would appreciate your reference. Really, they will not be very happy about that. But if you have an education supervisor and everybody knows that you are in that process, they will be doing their best to support you. As well, your education supervisor will be your advocate in a way. When they speak among consultants, oh, he is going to submit the application in a few weeks' time. I think he's ready. I've been meeting with them regularly. I think they have done this and this and this. So they give a good impression about you. So unfortunately, you're not as supported as a trainee, but you need to take charge of your own training, and you need to get the consultants involved in your training in the same way as they would do for a trainee. And that's the difficult part.
Yeah, I think, but I think this is a good advice that an educational supervisor would like to have regular meetings with them and throughout the process. Do you think that hospitals get like when they say, oh, this hospital doesn't support CESR, is it because they don't like the process, or because they don't like the person, or or they don't like when the people say go for a hospital that supports CESR? What do they mean with that?
That's a difficult question to answer. However, there are hospitals that are much more service oriented. In other words, the whole department work is heavily based by staff grade doctors.
Mm-hmm.
Whether we like it or not, this is a reality. In some parts in the UK, where the department is heavily on the shoulder of the SAS doctors. Mm-hmm. This raises two questions. Why this SAS doctors did not progress in CESR, or and how much they are supported. So we need to ask them. It's a really fine balance, and I think, in my own opinion, it's a very individual thing. I wouldn't say there is a place that is known to support or not known to support. I think it's an individual thing, case by case, and most of the time it really depends on the motivation of the individual, because it takes a lot of hard work to do the CESR while you're not a trainee and you're not supported. It's much easier to just forget and carry on with doing the job and not be worried about any other aspects. And it's a very easy trap to fall in, and probably most of the trust will be happy if you're just providing the service and don't have any demands or any ambition. But if you're motivated, people will help you. If you seek and ask and make it clear that you want to progress, generally people will be able to help. But if you're stuck in a place, I mean, that you clearly are motivated and you want to progress and people are not supporting you, I guess, advisors to move.
Do you think it's better for the application if you stick to one place and try and make a good relation with them, and or to move and have like different experience and different maybe referees from different places?
It's certainly good for the final part of the application, at the time when you apply, to have been stable in a place for at least 6 to 12 months. Before that, it's good to have to gather experience, especially if you're doing in general surgery, for example. I had my CESR in general surgery. My last job was only oncoplastic. So by the time I reached that job, I have completed the numbers needed for general surgery. So it's a really fine balance whether you probably gather a lot of experience from going to different places. But my advice is not to apply before you are at least in 6 to 12 months in one place, because your final application is your final job is probably where you get most of your referees, and you are required to have the CD from that final post. And this, they need to know you well. They need to know you well to provide a reference. The problem, if you are, the drawback of being in one job for extended time, is that maybe you are going to miss an aspect of training. However, it's not the end of the world. If they come back to you and address some aspects of training that you need to address, like what I did, I went to other department. So I asked my colleagues, for example, they asked me to do some vascular surgery. So I went to vascular surgeons in the hospital where I was doing oncoplastic and spent some time with them. Go to the clinic, go to the rounds, spend some time on calls to try to cover the aspects. Okay, if this is not possible in the trust where you are, and there is a certain specific requirement that does not exist in the place, unfortunately, you will have to address it in a different place.
Between the first time that your application failed and between the second time that you've submitted, how long it took, if I can ask?
They give you a 12 months period. That's a standard.
Okay.
They give you a maximum of 12 months to cover all the aspects. Mine, I covered in 6 months because they needed some very little things, just very fine tuning, yani. So it was ready very quickly.
All right. I think that was really useful. I think it's doable. It's just hard work or a
Yes.
marathon. It's a marathon. And if someone is thinking about it, I think they should make sure that they collect every evidence as soon, because if you started to collect that at the end, it will be more difficult to get.
Oh yes, definitely collect as you go. Collect all evidence as you go. Keep track of everything you do. That's what I advise. I even kept track of clinic lists to demonstrate the case mix.
Oh, okay.
I was saying, I mean, keep evidence of everything you come across. Everything is useful. As I say, remember, they know nothing about you. They want to paint a detailed picture of who you are without the help of the training system. So you have to help them doing that.
Thank you a lot, Mr. Youssef.